question per person, so we can advance as much as possible. So we will start with the Lusa News Agency. That's a Portuguese-speaking news agency. Can you hear us?
Yes, can you hear me?
Yes, is it Antonio?
Yes, this is Antonio, thank you.
Please go ahead.
Well, I would like to ask a question on the issues of birth and newborn care and breastfeeding. Does the WHO recommend any restrictions on breastfeeding, presence of partners in delivery rooms, and skin-on-skin contact between mother and child because of the pandemic? Because health authorities in a country like my own, Portugal, have banned these practices for women that are infected. Thank you.
Thank you for the question. So we have recently published some guidance on clinical management of individuals who have COVID-19, which includes pregnant women and lactating women, breastfeeding women. And it is very important that women are able to breastfeed their children when they're born. There are certain precautions that need to be taken place in terms of contact precautions, but we outline the ways in which that could be done safely.
On the first one, based on the transmission in countries, WHO has categorized actually countries into four. There are countries with no cases, what we call the 4 Cs. No cases are a group of countries, and then the second is countries with sporadic cases, and the third is cases, countries with clusters of cases, and the fourth is community transmission. And we have now a number of countries with community transmission, and that's why we have developed a guideline that's tailored to these four situations. And please check our website and you will find the 4 C's and the 4 categories and what should be done based on this. But we have community transmission in many countries, and we have said it many times. And then on the issue of lockdown, so-called lockdown, maybe some countries have already taken measures for physical distancing, closing schools and preventing gatherings and so on. That can buy time. But at the same time, each and every country actually differs. Some countries have strong social welfare system, and some countries don't. And I'm from Africa, as you know, and I know many people actually have to work every single day to win their daily bread. And governments should take this population into account, okay? If we're closing or if we're limiting movements, what is it going to happen to those people who have to work on daily basis and have to earn their bread on daily basis? So each and every country, based on its situation, should answer this question. We're not seeing it as an economic impact on a country, as an average of GDP loss or the economic repercussions. We have to also see what it means to the individual in the street. And maybe I have said it many times, and I come from a poor family, and I know what it means to always worry about your daily bread, and that has to be taken into account, because each and every individual matters, and how each and every individual is affected by our actions has to be considered. And that's what we're saying. It's about any country. It's not about India. It's about any country on earth. Even the wealthiest country on earth can have people who need to work for their daily bread. No country is immune. Each and every country has to really make sure that this is taken into account.
Thank you very much. Next question, Associated Press, Jamie.
Stabilize requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. What is the strategy now to put in place the public health measures that will push down the virus after those measures may be released? And then how do we take care of people better in a clinical environment to save more lives? So yes, potentially stabilizing, and it is our fervent hope that that is the case. But we have to now push the virus down, and that will not happen by itself.